Hi, I'm Dr. Jeffrey Riopelle. I'm a cosmetic surgeon in San Ramon, California. And today's topic is on liposuction. Liposuction is designed to get rid of unwanted fat. Many of us have little bulges here and there throughout the body that we don't want anymore. And we may have done a lot of exercise, a lot of work on that over the years, tried to eat specially, lost weight, and yet those bulges remain. So this is where liposuction has its role. Now, liposuction is not really a weight loss technique. It's a fat reduction technique for a specific area. So, for example, I can think of a woman I saw last week who was 45 years old. She came in with a little bulge of fat in the belly and a bulge in the love handle areas, and she'd been working hard to get rid of those over the years, but it just wouldn't go away. She had tried exercise and diet and had been able to get her weight down some, but nevertheless the fat was still there. It was just resistant. We sometimes have areas that are just resistant to weight loss no matter what we do. So if someone has this, then that person is a prime candidate for a liposuction procedure. It used to be that liposuction had to be done under general anesthesia with all the risks of anesthesia. Nowadays, we have much better technology. We can actually do liposuction while people are awake, very comfortably, simply under local anesthetic with maybe something to relax. And the reason that we have this nowadays is because we have technologies that can actually melt the fat. This is the Smart Lipo laser. Smart Lipo is laser liposuction. And what laser liposuction does is it simply melts the fat inside before it's suctioned out, so that instead of having to aggressively suction it out like in the old days, it can simply be removed as easily as removing butter from a container that's been melted. So let me tell you a little bit how this works. For example, for the 45-year-old I was talking about, she had the bulge in the front. She would come in and we'd have her give her something to relax, and then we give her some little shots of numbing medication in the fat and the skin, and then we make a little tiny incision and place the little tiny 1 millimeter laser fiber in and melt the fat. If we needed to melt more fat, we have something that's a little stronger called Vaser, which is also a little tiny cannula, something that has ultrasound coming out of the tip and melts the fat through ultrasound. So we can use either one of these technologies for fat melting. Once the fat's been melted, we then take another cannula, again fairly small, and simply suction out the fat, as I mentioned. After that's done, if we need to, we can tighten the skin, because many people, once the fat's suctioned out, will have some loose skin, especially from if pregnancy stretched out the skin in the belly, for example. And in that case, what we do is, again, we put the laser in after suctioning out the fat, and laser right under the skin, which heats the collagen and causes the collagen to contract. And then over the next 6 months, the collagen actually grows. So what are great places for doing liposuction? Well, we can use it for the belly, the love handles, the back. The arms are a wonderful place. Many people have this fat hanging down or loose skin hanging down that can be tightened and contracted. We can use it for the back, the legs, the inner thighs, outer thighs, the knees even. So almost any place on the body where there's an extra bulge or a couple bulges can be performed with the Smart Lipo procedure. Now, what about the permanence of Smart Lipo or Smart Lipo Ultra in our office? Well, when we've removed the fat cells are gone, and we only have so many fat cells in a given area. So what happens when we gain weight typically? Well, the fat cells are already there and they enlarge. So if we've removed those fat cells from the area, the fat cells are no longer there, so you have still some fat cells, a few here and there, and those can get a little bit bigger, but they generally won't ever get back to as large as the area that we've removed because they simply can't. There aren't that many cells. So when we've done the procedure, it's a fairly permanent procedure unless one gains back a lot of weight. And so that's another great thing about it is once it's been performed, that you're going to have that weight loss in that area from that time on, presuming that you do a good job of maintaining your regular exercise and diet program. So we have lots more to tell you. We'd be happy to tell you about it in our office. Also, please click on the below sites if you'd like further information on some of our other cosmetic procedures. And thank you very much for listening to our information.